Hi, my name is Mackenzie Harper. I am the Program Manager for Education for the Dr. Lorna Breen Heroes Foundation. And I am so thankful to be here with you, Dr. Cunningham, to talk today about your story and all that you are able to share with us, and looking forward to learning from you and speaking with you today.
I am a surgeon by trade. I'm a surgeon at Massachusetts General Hospital. I'm also a researcher. But the way I wound up here is having my own difficulties, struggles with mental health. And I made the decision as the president of the Association for Academic Surgery this past year, that at my presidential address, to share my story.
While being a perfectionist undoubtedly leads to external successes, it is also the thing that prevents you from seeking help, from admitting to yourself or anyone else that you are human. It isolates you. If perfection is your goal, you will live your life in a constant state of failure. This has been my greatest addiction.
What are some goals that you have, or the changes that you feel are necessary in order to protect the well-being of the healthcare workforce?
The first thing to approach is changing licensure and the credentialing. And that will just change from that level down, at least the ability for people to seek help professionally and not have their licenses revoked without cause, right? Obviously, patient safety is number one. Arming leaders in all hospital systems, in medical schools, in all training programs, with how to have a conversation about suicidality, about risks for developing depression, and once you have depression, resources to reach out to that are accessible to medical students and residents, because residents are up 24/7. They don't have a regular schedule. They never know what their schedule is going to be a week from now. They're not going to be able to schedule a regular once-a-week therapy session. Nor can they afford it. Most therapists are cash only, or insurance companies do not pay for that.
Well, the mission of the foundation is to reduce burnout, but also to safeguard the well-being and also job satisfaction of clinicians.
Yep.
And I know this is a mission that is important to you, and your work is so amazing.
We need to advocate for ourselves and our colleagues, and we need to approach this on every level, from self-care to a cultural shift. Mental health disease is pervasive. Suicidal ideation is shockingly common. We have the opportunity to change our culture. There is no easy fix, and I do not have all the answers. I do know that it won't get better unless we talk about it openly and honestly.
You can do your part wherever you are. And a lot of people came up and said, "Oh, that's great. You're doing this, you're doing that." I'm like, no, my job is done here, at least for today. Your job is to look around you. If you have a friend that appears in distress, or had a complication in the operating room, had a loss in the family, that is not a time they need their alone time. No, they do not. I'm telling you that they want you to reach out. They may not feel like reaching out, but just to reach out. That's on the smallest scale. Just be kind. Don't ever assume you know what's going on in someone else on the inside, and that we are all human and we are here for you.
Thank you so much.
Yeah.